What's going on, everyone? Dr. Tom Walters from Rehab Science. Welcome back to my channel. In today's video, we're looking at 4 of my favorite exercises for targeting gluteus medius and gluteus minimus. These are 2 muscles on the back side of your hip joint. Their tendons attach on the outside of the hip. So if you have pain in that region or you're just looking for exercises for these muscles, stay tuned for today's video. Before jumping into today's exercise, I just want to mention that if you're looking for a more comprehensive program for gluteus medius and minimus, in the hip chapter in my book, there is a gluteal tendinopathy program, which will include the exercises I'm covering today and many more. The program has a description of each condition. It then takes you through 3 phases of a program. Phase 1 will have soft tissue mobilizations, things that help reduce pain. Phase 2 will have stretches and other mobility exercises. And then phase 3 will focus on strengthening exercises that help build capacity in the muscles and tendons. So if you're looking for something more comprehensive, I will put the link for the book down in the description. All right, so gluteus medius and minimus are technically hip abductors. They bring our leg out to the side. So one of my favorite exercises, and honestly one of the best for targeting these muscles in the research, is called sidelying hip abduction. So what you're going to do is lie on your side. The leg you want to target is going to be the top leg. So I'm going to lie down. In this case, my right leg will be the one I'm working. Your legs are going to go out straight. You're going to put your hand up here on your hip, and then you're going to roll forward slightly. Now my leg is going to go up into abduction and back slightly into extension. So I'm going to go up and back, and I'm looking to fill it right here where gluteus medius and gluteus minimus are located. So up and down slowly like that. Moving nice and slow, and really working on thinking about that kind of mind-muscle connection, feeling it right here in kind of that back outer hip area. So with all these exercises, I'd go for 3 sets of 10 to 15 repetitions. Again, these are primarily used for pain on the outside of the hip right here near this bone, the greater trochanter, but they can also really help with back pain, SI joint pain, and even many cases of knee pain. Tons of research for glute strengthening in terms of back pain, hip pain, and knee pain. Okay, so that's our first one, sidelying hip abduction. Our second exercise is a single leg bridge. This is another great one for these 2 muscles. So you're gonna lie on your back. If I'm working my right leg, I'm gonna straighten my left leg so that it's not helping. And then I'm just gonna push up and down, push into the ground, and then up. So I've got a straight line from my knee through to my shoulder. You can hold for a second at the top. Again, looking for 3 sets of 10 to 15 repetitions. This will also work our hip extensors. It's mainly a kind of hip extension based movement, but gluteus medius and minimus are highly active, helping with this movement and also stabilizing the hip and pelvis. All right, so that's our second exercise, a single leg bridge. Gluteus medius and minimus, as I mentioned, they abduct our leg, but when we're standing on one leg, they help to control our pelvis. So this next exercise is called a pelvic dip. It's going to train these muscles in a closed chain fashion, like where we're standing on one leg like we would do when we're walking. So if I'm working my right leg, I'm going to put it up on the step. My left leg is going to hang out the side, and then I'm going to use my glutes on this right side to slowly lower the opposite side of my pelvis, and then to pull it back up. So I'm really thinking about squeezing my glute muscles and activating my glute muscles the whole time. I'm not using my abs or my low back muscles. It's just these glute muscles on the right hand side. So they're allowing my pelvis to drop, and then they're lifting it back up. This one, when you do it right, you can really feel a good burn and squeeze in gluteus medius and minimus. So again, look at 3 sets of 10 to 15 repetitions, and this is our third exercise, the pelvic dip. The last exercise is a skater squat. This is a variation of a single leg squat, but it's more hip biased. We're going to sit back and lean our trunk forward. Both of those movements have been shown in the research to help us activate and strengthen our glutes, and they take some of the work off of our quads on the front of our thigh. So what you're gonna do, if I'm working my right leg, get into that single leg squat position, and then I'm going to stick my butt back and lean my trunk forward. Thinking about kind of this hip hinge pattern. So my low back stays mostly straight and I bend at my hip. This, again, is really gonna strengthen a bunch of muscles, especially our glutes, but it has been shown in different studies to be one of the best exercises for activating and strengthening gluteus medius and gluteus minimus. Again, this one can really help with knee pain because I'm thinking about controlling my knee at the same time, keeping my knee stable, not letting my femur move around. That's really what those glutes do, is they control this long femur bone. So again, look at 3 sets, 10 to 15 repetitions. Make sure you do both sides on all of these exercises. So that's our 4th exercise, the skater squat. Give these a try. If you have any questions, put them in the comment section and I'll try to get back to you. See you guys in the next video. Bye.